Hi, this is Dr. Josh Hustedt. I have an exciting story to share of one of our patients who was treated with knee denervation. Knee denervation is an exciting, new, minimally invasive surgical technique that allows for the treatment of joint pain. The patient in this story presented to our clinic having failed all conservative management from other orthopedic and pain management providers. She was an 82-year-old female who had significant degenerative joint disease of her right knee. As you can see from her x-rays, she had significant osteoarthritic change. She was treated initially with conservative management, then with physical therapy, then with injections, both cortisone and viscosupplementation. She was further sent to an arthroplasty surgeon who felt that her bone quality was too poor and her age too advanced to receive a total joint arthroplasty. She was therefore told that her only remaining options were chronic pain management with medications. She was referred to us for evaluation of our new surgical technique in knee denervation. The knee denervation technique identifies the nerves to the joint. Instead of replacing a joint like we would with a joint replacement, we simply find the nerves themselves, we cut the nerves, and then we transfer those nerves to surrounding muscle. What this does is it takes a sensory nerve and allows it to grow into muscle and become a motor nerve. This tricks the brain into thinking that there's no longer pain coming from the joint and interrupts the signal between the joint and the brain. This also further changes the cortical response in the brain so that you no longer feel the pain. It doesn't change the fact that you have arthritis, but it makes it so you can't feel it anymore. This allows for a very quick return of function with very minimal risk. This is our patient's story from her 6-week follow-up.
I had trouble finding someone that would even talk to me because of my age. And he said that my knee was totally shot and there was nothing that he could do. And he said if I tried, I would break probably your bone that goes below because it was too narrow. I mean, it's very small.
So they were talking to you about doing a knee replacement because you have arthritis.
Yeah.
But they felt that your bone quality was too poor and you're too old basically to have the knee replacement.
Well, and he just said the knee is, just shot. It's just not feasible. So, but he said, I'm going to send you to someone else. And that is you.
Wonderful.
And I am so pleased that I did. I think it's a blessing. I mean, it was just something out of the blue that we found a doctor that would even see me and then send him to you.
Yeah.
And I tell everybody about it. I have never had pain from the surgery. I never took pain medication. I was walking the day I come home with my walker, of course.
Yeah.
And I would do it again in a heartbeat.
Wonderful. And most importantly, you're dancing again.
Oh, I'm dancing.
Which is what you wanted to do so
And I'm
much.
also now graduating to my cane in the house. I can walk around in a cane, and Bert said, oh, where's your cane? And I had walked halfway through the house without that, but that's what we're working on now at physical therapy.
Wonderful.
And I'm very happy.
Most excitingly, this patient was able to return to dancing and ambulation without the use of an ambulatory device. She had walked with the use of a walker or a cane for greater than 5 years and was able to get rid of both her cane and her walker and return to dancing again. If you or anyone you know is interested in learning more about joint denervation, feel free to look at our website at jointdenervation.org or bannerhealth.com/jointdenervation. You can also call our office at 602-521-3250 to make an appointment.